In today's Guideline Bite, we'll be going over the section on Immune Reconstitution Therapy for Inborn Errors of Immunity from the American College of Allergy, Asthma and Immunology and American Academy of Allergy, Asthma and Immunology's Guideline on Inborn Errors of Immunity. Let's get started. The guideline suggests that allogenic hematopoietic stem cell transplantation, or HSCT, for patients with IEI be performed at a center with experience in HSCT for IEI. The guideline recommends that patients with typical SCID or leaky atypical SCID receive definitive therapy with allogenic HSCT or gene therapy. The guideline recommends that patients with congenital athemia disorders be treated with cultured thymus tissue implantation, or CTTI. The guideline recommends that patients with CID disorders who have severe cellular immune defects or who manifest severe or refractory disease complications be considered for allogenic HSCT. The guideline recommends that patients with primary hemophagocytic lymphohistiocytosis or HLH disorders and patients with X-linked lymphoproliferative disease type 1 be evaluated for allogenic HSCT. The guideline suggests that patients with immune dysregulation who manifest severe or refractory disease complications be evaluated for allogenic HSCT. The guideline recommends HSCT for patients with defects in neutrophil number or function associated with severe clinical phenotypes. The guideline suggests HSCT in patients with innate immune defects affecting hematopoietic cell lineages and who manifest with recurrent, persistent, severe infections. The guideline recommends that any patient with IEI who receives definitive treatment with HSCT, CTTI, or gene therapy receive lifelong follow-up by clinicians experienced in evaluating immune reconstitution and monitoring for long-term complications of these procedures. And there you have it. Stay tuned for our next Guideline Bite. We'll be going over recommendations on precision medicine in inborn errors of immunity and quality of life in inborn errors of immunity. Make sure to check out the full guideline from the American College of Allergy, Asthma and Immunology and American Academy of Allergy, Asthma and Immunology on GuidelineCentral.com.